just going to be demonstrating how to care and clean for your colostomy bag, now that you have one. So I'm just going to demonstrate on this dummy here. So this colostomy bag, you're going to start by removing the bag. So you want to apply pressure and just remove the bag. And then you want to just use scissors to cut off the end of the bag. And then you want to dispose the contents into the toilet. Okay, and then we're going to start, there's an adhesive wafer on the back here, as you can see. So you want to start by applying pressure, and then you want to remove the adhesive wafer and use a little bit of pressure. So you're going to place the used bag into a disposable bag and dispose of it. And then you want to use a damp washcloth, and you just want to dampen it with some lukewarm water. And then you just want to clean around the stoma. So you want to clean around in one direction, making sure it's nice and clean. And then you can dispose of that. And then using a dry washcloth, you can just dry around the surrounding area, making sure that it's nice and dry. You never want to apply a new bag unless it's thoroughly dried. Okay, so now that it's clean, this is our new bag here. So these bags, you're able to cut it according to your stoma size. So you may need to cut it, so you can just use scissors, and there's directions on here to allow you to cut to whichever size you need. Okay, so if you just want to lift up your scissors, we'll just see here. So you just want to remove the protective covering, okay, like we already have. And then you're just going to apply directly according to the size when it's already been cut. Just want to apply, and you're just going to press around to make sure that it sticks accordingly, like so. Okay, so you can see that it's being fit properly. And you can just also want to tug a little just to make sure that it's put in place properly. And you just want to also press with your fingers along the center to make sure the wafer has been put in place. Okay. So that's the new bag. Now you also want to look and make sure that your stoma is always this beefy red color. And always want to look for signs of infection. So any redness or heat or pain or any sort of drainage, you'll want to see your doctor right away. Okay. So you have any questions?
When can I change the bag? Like how often?
It always depends on the person as well as the type of bag. So we're using disposable bags. So you're able to change it every day, but usually people are changing it every 3 to 7 days.
Oh, I see.
Yeah, but it also depends on you and how comfortable you feel that you're able to change it daily as well.
Alright. So when I change the bag, can I use a perfume, or can I put alcohol? Use alcohol when I clean the around the stoma?
It's better not to use any sort of soap or any kind of perfumes that's only going to irritate the skin, and we don't want to have any infections, so it's better to avoid using any sort of soaps or irritants around. So just using the damp washcloth like I showed you, with nothing on, no soap or anything, just cleaning it daily will ensure that there's no irritants around it.
Okay. Is there any food that I need to avoid? Like those food that can harden my stool, right?
Yes, you want to avoid like any sort of fatty foods that's gonna upset your abdomen.
Oh, okay. Okay.
So any other questions?
So far, no.
Okay.
Yeah.
So that's all for today. So I will leave my card with you. If you have any questions, you can always call me directly.
Okay. Thank you for some.
You're welcome. Demonstrate how to clean the stoma. Just ensure that you're doing it correctly, and if you have any other questions after your demonstration.
Okay.
Okay.
So first, what I have to do is I have to cut the bag, the end of the bag, so I could throw all the feces inside, and then throw it in the toilet. And then right after I did that, I have to take this off. And then there's gonna be on the adhesive part, so I have to apply gentle pressure so that I can remove the the adhesive around
Yes.
around the stoma. So when I take it out, I can use a warm washcloth and dip it in warm water, and then I will clean around the stoma. So while cleaning it, I have to check if there's any infection, any signs of redness, skin irritation around the stoma, and I also have to check the color of the stoma. So it should be beefy red, and then the opening, the stoma, shouldn't be getting bigger.
Yes.
It should be remain the same size, and then I should avoid using any alcohol or anything before I put the stoma. Yeah. So and the new bag. So so after that, I just have to put it in, make sure that it sticks to the skin. Yeah. So I can also try gently pulling it to check.
To make sure
Just to
something
make
is,
sure. Yeah. So I think it's good. So it depends on me. So usually it's around 3 to 7 days before I change the bag. But if I'm using the disposable one, then I can change it every day. If anything, there's any problem, if I'm seeing any abnormalities, then I could just give you a call, or I can also give the doctor a call.
Yes, that sounds perfect, Myra. That looks like you have everything in control, so you feel confident that you're going to be able to do this on your own from now on. Okay, so that looks good. So if you have any other further questions, please feel free to contact me.
All right. Okay.
All right.
All right. Thank you.